Good morning again. There's a two presentation in person, but till they come, we can start Zoom presentation. Dr. M. Vanisiri, are you there?
Yes, sir.
Dr. Vanisiri, can you start your presentation?
Yes, sir. I couldn't share the my slide.
Not yet shared.
Yeah, wait.
Dr. Vanisiri.
I couldn't share this slide.
Okay. I will start your one presentation. Mr. MACD Aludgama from Gampa Vikramachi University of Dr. Vanisiri.
Can give me 5 minutes. Wait.
You can email me the slideshow, then I can play here.
Okay, thank you.
Maybe.
Good morning. I am Mr. Abid Kumar, an undergraduate student from Faculty of Indigenous Medicine, Gampa Victoria University of Indigenous Medicine. My topic is a systematic literature review, therapeutic value of Pushpadana Rasa in and infertility. This is the introduction of my study. Infertility is a disease of reproductive system defined by the failure to achieve a clinical pregnancy after 12 months or more of regular unprotected sexual intercourse. It is prevalent problem affecting about 10 to 12% of the couples worldwide. And in today's era, it is one of the burning issue globally, and it affects to the couple both socially as well as psychologically. And when the cause of infertility exists within the female partner, it's refers to as female infertility. And also when the cause of infertility exists within the male partner, it is referred to as a male infertility. And these are the main objectives of my study. General objective of my study is to identify the therapeutic value of Pushpadana Rasa in infertility, and these are the special objectives of my study. First one is to identify this and synthesize all relevant literature on the therapeutic value of Pushpadana Rasa in infertility. And the second one is to assess the efficacy and safety of Pushpadana Rasa in the treatment of infertility. And the other one is to identify the underlying mechanisms of action of Pushpadana Rasa in infertility. This is the background of my literature. Disease review, mainly it causes problem with ovulation and pathological conditions, burning of fallopian tubes, uterus, and the other one is with cervix and the hormonal imbalances. In the Ayurveda, female infertility can be correlated with Vandhyatva, according to the Charaka, Shushruta, and the Haritha Acharyas. According to Acharya Charaka, as he compiled Vandhyatva as a complication of Yoni Vyapat, and the Acharya Shushruta compiled as a Yoni Vyapat, and the Acharya Haritha defined Vandhyatva as failure to achieve child rather than pregnancy. And according to Rasarana Samucha, its Acharya compiled in this condition, Kakavandhyatva. And it is the Samprapti of Vandhyatva, mainly all of the disease caused to the Agnimandya, mainly in this condition, Nidana Sevana Vatakapavardhana, and it causes to Agnimandya, and Agnimandya causes to arm formation at coast and dhatus level, and it causes for Rasadhatva Agnimandya, and it causes for Kitta Bhagavardhana, mainly Kappa Bhagavardhana parts, and it causes for Shotas at Kapashias, and it also causes improper formation of Rakta Dhatu. It causes for Raktashaya, and mainly, finally, it causes for Arthava Dushti. Artha Dushti are the disorders of menstrual cycle. Due to the Atharagni Mandya, defect of the formation of mainly main dhatus, mainly Medha, Shukra, and Rasa dhatus. Samprapti Gatakas of the Vandhyatva are mainly doshas are involved in the Kapha and Vata, Dusha or dhatus involved in the Rasa, Rakta, Medha, Shukra, and the Shrotas involved in the Rasarakta Meda Shukra, mainly Arthavaha Shrotas, and the Agni involved in the Jataragni, Rasadhatva Agni, and also Soto Dushtis in this condition is Sangha. My study is literature review. This is my methodology. This is the study. My methodology. I studied authentic Ayurvedic text like by Sajjaratnavali, Rasatarangani, Rasaratna Samuchya, and data was collected from the web searches like electronic databases, Google Scholar, Medline, PubMed, and Scopus. These are the results and discussion of my study. Mainly, Pushpadana is a herbal mineral drug. It has 5 main ingredients and 5 main sources like juices using plants. These are the main ingredients using to produce Pushpadana rasa, Rasa Sindura, Nagabhashma, Abrakabhashma, Vangabhashma, Lauhabhashma, and all the ingredients use 1 part of quantity, and these all ingredients have Vrusha, Deepana, and like properties, mainly Vrusha, Deepana, Pachana conditions helps to cure this infertility condition. These are the Bhavana Dravyas used to preparation Pushpadana rasa. First one is Dhaturasa rasa, Yashtimadu Kashaya, Shalmanikata, Nagavalli rasa, and Vijayakata. These Bhavana Dravyas have also Vajikarna, Garbhadana, Kamottejana, like properties and qualities. This Pushpadana rasa dose is 125 milligram or 1 Raktika. Used to as Anupana, Madhu, Krita followed by Sita Yukta Kshira. Probable mode of action of Pushpadana rasa is it has mainly Tikta rasa, Ushnavirya, and Lekana Swabhava. They helps to Vata Kapha Shamana, and all the ingredients possess Deepana Pachana Swabhava, helps to correct Agnimanda and Oma formation, thus by relieving Shrotorodha. And also Lauhabhashma helps to remove Agnimanda by its Deepana property, and also Lauhabhashma have higher iron concentration. It helps to Rakta Dhatu Prenana action, and also Lauhabhashma, Nagabhashma, and Mangabhashma possess Lekana Swabhava. It helps to remove the Shrotorodha, aiding for Vatanuloma. And also it creates a proper Vata action. Shrotorodha, loss of Shalaguna of Vata, and Vata dominance creates Sankocha. Lekana Ushna property of the combination helps to remove this condition. And also due to Lekana property, this drug may help in reducing the size of uterine fibroids, cervical cysts, like growth conditions. And also Pushpadana rasa is a Vrusha drug. It directly affect on Shukradhatu by its prabhava. And also Rasa Sindura possess Yogavahi property. It helps to enhance the potency of this combination. And observations based on previous studies in this slide, and it effective in psychological imbalances associated with polycystic ovarian syndrome, and found effective in strengthening the female reproductive organs, and it can effectively manage the infections of reproductive organs like chlamydial infections. In most of the studies, this drug is used in combination with Palasarpi. Palasarpi is used to infertility and the maintenance of pregnancy. After proper Shodhana, it improves Pushpadana rasa improves the ovarian functions and promotes normal follicular maturation. And also, if the patient is lean and complains of fatigue, then Pushpadana Rasa should be used along with Madhumalini Vasanta Rasa. This is the conclusion of my study. Mainly, Vandhyatva goes to the improper Agni. It results for formation of armor, and it goes to armor formation results to Shrotoroda. It leads to Vata Prakopa, according to Ayurveda. It goes to Koshtagnimanda, Dhatagnimanda, and improper functioning of dhatus, especially Rasa, Rakta, Medas, and Shukra. Mainly Shukra dhatus involved in this condition. Also, Pushpadana Rasa is known as of these factors of improved fertility. It helps to balancing Agni, reducing armor, and remove Shrotoroda, pacify Vata, improve the functioning of Rasa, Rakta, Medas, and Shukra, and it improves the proper action of Vatanuloma. These are the recommendations for further research. Conduct randomized controlled trials to investigate the efficacy and safety of Pushpadana Rasa in the treatment of infertility. The second one is investigate the mechanism of action of Pushpadana Rasa in the treatment of infertility. And the final one is evaluate the long-term safety and efficacy of Pushpadana Rasa in the treatment of infertility. This is my bibliography. And thank you. No. Yeah. We normally we used in our clinical trials, we used to put Pushpadana Rasa both male and female infertility.
But here you are just presenting only about. So when it comes to the implicit circuit, we're supposed to do a survey about other.
We used mainly in clinical for infertility. This.
Why not the other one? Why this is better than the other one?
Mainly this is a herbal mineral drug. The other drugs also they used to prepare only herbal drugs. Some other drugs only rasa drugs. I think it is anyway.
So if you write as a literature survey, you have to have a comparison of other Ayurvedic medicine. Another Ayurvedic medicine. So maybe you could have included a bit more studies saying what's the outcome of how many people had pregnancy after taking only this. Those information are not everything missing, but very important. And why they are taking this medicine, are they can they need any other form or there is any restrictions along with the medicine? So do they have to have a food control while they are taking the medicine?
Yes, all the this is a herbal mineral. It is a rasa drugs, and we advise them to control kakarashtaka and like Ushna Tikshna, including Ahara Virana. Thank you.
Dr. Vijita.
Just Sambat. Yes, it was a very nice presentation and informative. It was informative one. So he has the way he done the presentation is very good and appreciated. Thank you very much.
Thank you, madam.
Uh, for our next presenter, invite Dr. Fernando from Gampa Vikramachi Ayurveda University to present her paper.
Good morning, all of you. I'm Dr. Badrani Fernando from Gampa Vikramachi University of Indigenous Medicine. Earlier, I worked as a temporary demonstrator in the Department of Kaumarabutta and Sri Roga in our university. And I am the founder and the owner of the Bhagyaswarna Ayurveda in Sri Lanka. Today, I am going to present a case study about the effectiveness of Ayurveda treatment for vitiligo. These are the content of my presentation. Now I move on to the introduction. The vitiligo is an autoimmune dermatological disorder which causes white discolored patches due to the deficiency of the melanocytes. It's a progressive type of a disease that grow with gradually destruction of the melanocytes and which resulting hypopigmented or depigmented areas on the skin. In Ayurveda, all kind of skin diseases mentioned under the heading of Kushta Roga. Shitra is also mentioned under the Kushta Roga. Also, it can correlate with vitiligo. In Kashyapa Samhita, it mentioned as Shweta Bhava Michyanti Shitra. It means the Shitra is a disease where the white patches present on the skin. Also, this Shitra condition can classify it as Vataja, Pittaja, Kappaja according to the doshic involvement. Due to the Atisevana of Asamyak Ahara and Viharana, it means due to the use of unhealthy food and behaviors, the vitiation in Tridosha occurs in the association with Rasa, Rakta, Mansha and Medo Dhatu. When the vitiation occurs in the levels of Rasa and Rakta, then Shitra can occur. In Ayurveda, the pathogenesis of Shitra Roga is nicely explained in Charaka Samhita and Sushruta Samhita. Now I move to aims. The aim of this study was to evaluate the effectiveness of Ayurveda treatment for vitiligo. This is a case presentation. In this case report, 51 years old female patient was presented to Bhagyaswarna Ayurveda Medical Center in Sri Lanka with the complaints of whitish discolored patches all over the face with itching condition from 6 years. The patient was early treated with allopathic medicines for 6 months before starting Ayurveda treatment. She reported moderate constipation condition in her bowel habits and no any urinary symptoms. The clinical examination was done on her integumentary system. These are the findings on examination. The site of the lesion all over the face. The lesion is epidermal and also color is white. And there is a moderate itching condition and also no any discharge condition. The temperate climate also found as an aggravating factor. This is the methodology. After the clinical examination, the patient was treated by the treatment protocol of Shodhana and Shamana Chikitsa in Ayurveda with the diet and lifestyle management. The oral herbal drugs and also external oil and paste application was prescribed for the patient for 6 months. After the treatments, The patient was observed for the improvement from whitish discolored patches and the itching condition. These signs and symptoms I take as the subjective criteria. And also improvement of the patient was evaluated by using Betty scoring method as objective criteria. This is the treatment plan. In first 3 months of treatment, I prescribed Amurtavasha Patola Kashaya, Manipatra Churna, Chandraprabhavati for the patient. And for the next 3 months, I prescribed Lagu Manjishtadi Kashaya, Tripala Churna, and Kaishora Gugulu for the patient. And also Bakuchi oil and Shritrahara Lepa used as an external application for the patient in these 6 months. In here, I use a grading assessment for the evaluation of subjective and objective criteria. For the subjective criteria, in here I used number of patches depending on the percentage of area involvement, color, itching condition, and hyperpigmentation condition as subjective criteria. And for the grading assessment for objective criteria, I used Betty scoring formula. For the Betty scoring formula, for the calculation of Betty score, it is need percentage of area involvement and the tonicity of the skin. Here I used the scoring method for that purpose. Now I move on to the results. In here, I mentioned the results according to subjective and objective criteria before treatment and after the treatment. This subjective criteria before treatment, the number of patches depending on percentage of area involvement was 70% to 80%. Then I score it as 3. The color was white color, scoring as 3. Itching condition is moderate, it score as 2. Hyperpigmentation condition is segmental, it score as 2. After the treatment, the subjective criteria, the number of patches were absent, then score as 0. Color was normal intensity, score as 0. Itching was absent, score as 0. Hyperpigmentation was absent, score as 0. Then I move on to objective criteria. After the calculation of Betty score, in here, the before treatment, patient was in the percentage of area affected, scoring as 5 because due to the condition of 70% to 80% stage of that pigmentation condition. And also the tonicity, skin tonicity condition was taken as stage 4 due to the depigmentation with compound of white and black hair. So the calculation before treatment take as 20. Then after the treatment, it takes 0. Now I move on to the discussion. After the 6 months of treatment, there was a 100% improvement seen in reduction of white discolored patches and also restoring normal skin with absence of itching condition. Also take as subjective criteria and Betty scoring calculation, there was an improvement from 20 to 0. In Ayurveda Charaka Samhita, it mentioned Sanshodhanam Visheshat Prayojayet Purameva Dehasya. It means the Shodhana along with Shamana Chikitsa in Ayurveda helps to remove the root cause of the disease and also stop the prevents the recurrence of the disease condition by eliminating the dosha conditions inside of the body. The medicines used in Shodhana and Samana Chikitsa in Ayurveda having Rakta Shodhaka, it means blood purification effect. Shrota Vishodhana, it has cleansing of the body channels. Pittahara, Kushtahara, that alleviates skin diseases and also immunomodulatory properties. Also in here, Bakuchi oil and Shrittahara Lepa used for local application in contains with sorolene and isosorolene is very helpful to stimulate melanocytes production. So the present study indicates that the effectiveness of Ayurveda treatment for vitiligo by increasing the immune system and enhancing the quality of life in less duration. So thank you for taking part with me. And is there any question? This is time.
This presentation, then we will. So the same process, so this one also while they were taking, there are some diet restrictions.
Yes, yes. For the skin diseases, especially in Ayurveda, it's nicely explained as the Nidan. We should prevent these kind of foods and also behavioral patterns. It means the spicy foods, the pitta condition increasing foods, and Viruddhahara. It means in Sinhala we call Viruddhahara. It's like compatible with each other. So we need to stop those ahara conditions. Yes. And also, basically in skin diseases, it is very important the Vireka condition. They eliminate the pitta condition inside of the body through that's medicines. Yes. Behavioral conditions. In this case, the patient, the main aggravate factor for this patient is temperate climate. So likewise, we advise with the condition of the patient to stop that kind of behaviors during the treatment.
We couldn't come back.
Yes.
So that white patches.
Yes.
Now that has gone.
Yes.
So the time it won't come back. Is it because
No.
it has
No.
removed from the.
Can remove because we treated for root cause of the study. In Ayurveda, in Charaka Samhita, it explains Shanshodhana Visheshat Prayojet Purameva Dehasya. If it do Shanshodhana treatments, cleansing of body channels is very important to prevent recurrence of the disease.
Dr. Vijita.
Okay, I am here. Dr. K.B. Fernando,
Yes, ma'am.
you have done the fabulous presentation. So that is the case study. These are the things we are expecting from the doctors to do the presentation about the case, what they are presented in the hospitals. Because of the presentation and the documentation, your case study is documented. So these are the things we are expecting from the Ayurveda doctors. You have established the case study in a very well manner. You followed the scientific writing style. You have started from the introduction up to the conclusion. You followed the scientific writing style. That is also I appreciate you. My question, not the question, the clarification is to how many follow-up visits you have done for the vertigo case study?
How many follow-ups means
Follow-up visits.
For this case study follow-up period?
Particular case study.
Particular 3 months.
3 months, 3 months, the duration of the study. How many follow-up visits you have done during the 3 months? Is it a once in a month or twice in a week, such a way?
Yes, once in a month.
So 3 follow-up visits. Am I right? 3 follow-up visits. Fernando?
Yes, madam.
So if it's a 3 follow-up visits, then for the objective assessment, so how you have done the results analysis part for the 3 follow-up visits for the objective assessment, because in the subjective assessment you have arrived the 100% of the improvement, but for the objective assessment, if you have the 3 follow-up visits, how you have done the assessment? The what test you have performed, the statistical test?
Yes. Do you mean during the treatment for follow-up period or after treatment follow-up period?
After treatment, during the treatment, you have done the follow-up visit, no?
Yes. During
After giving the medicines, every once in a month, you have done the follow-up, according to you.
During the treatment, twice a week. It means 2 times.
2 times for a month. So if it's a 3-month study, there are 6 follow-up visits.
Yes.
6 readings you have.
Yes.
So how you have done the analysis? What are the statistical tests you have performed to conclude the objective assessment?
Objective assessment, in here I used a weighted scoring method. So then I take those readings for the analysis. In here I mentioned final one, the last.
Have you done these things in Excel or SPSS?
Excel, yes.
Excel. You have taken the mean value and finally you have done that.
Yes.
Huh?
Yes, ma'am.
Okay, thank you very much. Okay.
Thank you very much, Dr. Badrani Pranandu. And now we can move our other Zoom presenters. So first, I like to invite Dr. M. Vanisiri for do the presentation.
Thank you, sir.
Dr. Vanisiri, do you need slide or
No, sir, I have.
okay, you can share.
Can you visible the Good morning, everyone. I'm Banistri, temporary demonstrator in Faculty of Siddha Medicine, Trincomalee campus. First of all, thank you very much to give this opportunity to me. Today my topic is literature review on Siddha herbal preparation, Arakan Kattai Thailam. This is one of the external preparation used in the skin disease conditions. So these are the contents of my presentation. Now I am moving on my introduction. And skin and subcutaneous diseases are nowadays common health issues in worldwide, and it made a major impact in our healthy life. So according to the 2019 data, in skin and subcutaneous diseases, 34% of diseases occurs due to the fungal infection, and 23rd percentage of skin disease occurs due to the bacterial infection. So in total, 98,522 people are died globally because of these skin and subcutaneous diseases. Among that, mostly the bacterial infections are causing the 72% dying in the skin diseases. And also further, the highest number of cases and deaths are identified in the South Asia country. So here I have put the chart. Most of the 72% of die occurs due to the bacterial infection. So I have mentioned the most common organism causing this bacterial infection. The Staphylococcus aureus causing the 29.2% of infection, and the Pseudomonas aerogenus causing 11.9%, and the E. coli causing the 8.9%, and in the Sri Lanka, overall prevalence of all skin disorders was identified as 63.9%. So nowadays the pharmaceutical industries, by using the modern techniques and equipment, produce expensive antibiotics, but the resistance against this antibiotic is a major health issues in past decades. So the natural plants are the good source to the development of new drugs to overcome this antibiotic resistance. So in our Siddha medicine, the medicines are deals with 32 types of akamarandakal, that means internal medicine, and 32 types of external medicine. This Arahankattai Thailam prepared by using cyanodactylin and Glycyrrhiza glabra and coconut oil, and it can used to cure the Karapan, Sori, Sirangu, and burning sensation in the extremities conditions. So I'm moving on my objective to study the pharmacological activities and phytochemical constituents and antimicrobial properties of each ingredients of Argan-Kattai Thailam. So this is my methodology. The study design was literature review using and scientific databases, and the data was collected from the authentic Siddha textbook and some scientific databases. And the data was analyzed by using the Microsoft Excel. So this is my results part. Here I have mentioned tabulate the medicinal uses of every ingredients in the Argan-Kattai Thaila. First of all, in the Glyceria glabra has the ability to cure these kind of diseases. Here I have highlighted the Vankuttam, Kalanjakapade, Karappa. These are mentioned in the Siddha textbooks. Some kind of skin diseases cured by using this Glyceria glabra. And next one, the cyanodon dactylon. This one also has the capacity to cure the skin diseases, and also it can use mixed with turmeric in the Sori, Sirang, and Padatamare conditions, and also it can mix with the Indupu, Kadakai, Kiranditakaram, and Kanchangore, and it should triturate with whey and apply can apply it in the Sori, Sirang, and the Padatamare condition. These are mentioned in the our Siddha textbook. And next one, the coconut oil. Coconut oil also has the capacity to cure the skin diseases like psoriasis, dermatitis, and eczema conditions. Here I have tabulated the phytochemical constituents of the ingredients of Argan-Kattai Thailam. First, the Glyceria glabra has the glycerin, flavonoid, alkaloid, steroid like phytochemicals. And cyanodon dactylon has the phytochemical like phenols, glycoside, flavonoid, tannins, alkaloid like that. And the coconut oil also has the flavonoid, tannins, and glycoside, alkaloid, and etc. Here I have mentioned some research finding related to the antimicrobial activity of each ingredient in Argan-Kattai Thailam and the responsible phytochemical constituents of this antimicrobial activity. First of all, the Glyceria glabra has the in the various extracts of this plant has the antimicrobial activity against this microorganism because of the presence of this clapridine phytochemical. Likewise, the methanolic leaf extract of Glyceria glabra has the better activity than the root extract because of presence of phytochemical like isoflavonoid. Likewise, it has the antimicrobial activity against both gram-positive and gram-negative bacteria as well as mycobacteria. So next ingredients of the Argan-Kattai Thailam is cyanodon dactylon. This one also has the antimicrobial activity, better activity in the ethanolic extract than the aqueous extract. Again, both antibacterial and antifungal activity against this organism because of the presence of terpenoid, tannins, and steroid, alkaloid, and flavonoids. And also the aqueous extract of cyanodon dactylon has the antimicrobial activity against this Staphylococcus aureus, this organism, because of the presence of flavonoids, phenolic substance like phytochemical composition. And also the ethanolic extract of cyanodon dactylon also has the antimicrobial activity against these organisms. The next ingredients is coconut oil. Coconut oil has both antifungal and antibacterial activity against these organisms. And also both coconut oil and lauric acid has the antimicrobial activity against these organisms. These are the some research finding again regarding my ingredients of argan kattai thailam. Here I have put the mentioned salt. Here I have mentioned antibacterial activity of each ingredients of argan kattai thailam in the percentage. Here I have selected 3 organisms. These 3 organisms are causing mostly causing the skin diseases. That's why we have selected these 3 Staphylococcus aureus and the E. coli and Pseudomonas aerogenus pathogens only. Here we have used 20 journals in the past 10 years to put this chart to calculate the antibacterial activity of the ingredients of argan kattai thailam. Here, the Glycyrrhiza glabra has the maximum antibacterial effect against the Staphylococcus aureus than the other organism. In the cyanodentactylin has the maximum effect against the Pseudomonas aeruginosa than the other organism. In the coconut oil, it has the maximum effect against the Staphylococcus aureus. So I'm moving on my discussion part. The natural plants are good source to prepare the modern chemical drugs and also source for the development of new drugs to overcome the antibiotic resistance. However, there is a need to scientific validation and safety evaluation of plants of the medicinal medicine before this could recommended for cure the disease. So based on this study, ingredients of argan kattai thailam reported to possess antimicrobial, antibacterial, antifungal, and the anti-inflammatory, antioxidant activities, and the phytochemicals like glycerin, flavonoid, alkaloid, steroid, terpenoid, and saponin, tannin, and glycoside. Further, the ingredients of argan kattai thailam possess the antimicrobial activity due to the presence of these phytochemicals. So, according to the Siddha textbook, also mentioned the ingredients of argan kattai thailam has the capacity to cure the skin-related disease. So, my conclusion of this study, the presence of phytochemical constituents influence the medicinal uses and antimicrobial activity of ingredients in the argan kattai thailam. So this is my suggestion. The further research should be carried out to confirm the efficacy and safety of this drug. These are my some reference. Thank you so much.
Thank you, Dr. Vanisiri. And Dr. Vijita, you have comment for him?
Yes, I have some comments. Dr. Vanisari,
Yes, ma'am.
the way you presented the presentation is very good. It's really appreciated, and the effort also I appreciated.
Okay.
May I see the objective slide, please? Objective slides.
Yes, ma'am.
Okay. What's your title, Vanisri?
Ma'am, literature review of herbal preparation, argan kattai thailam. Literature review.
Okay. You are the sole author, or is there any co-authors?
Yeah, ma'am. Co-author is there.
Oh?
Yeah, co-author is there, ma'am. My university lecturer, Dr. P. Parunam.
Dr. Varuna is the co-author. Okay.
Yeah,
Okay. What I want to say is the title is the literature review of the Argangata Thailam, but the objective is to know, to understand, or to study the pharmacological activity and phytochemical and the antimicrobial properties. So I thought there's a slight modification of the title should be done, because it says the literature review. When I saw the title, I thought you are going to say about the Argankata Thailam, which is mentioned in the different literature. What are the ingredients mentioned in Parajasagaram? What are the literature? What are the ingredients mentioned in any other textbooks which are available in our system? So such a way you are going to move like that. I thought when I saw the title, after I saw the objective only, I got to know you are going to explain about the pharmacological activities and the phytochemical constitutions. So your title should be modified in a little, which is much with the objective.
Okay, sure, ma'am.
Did you get the point, Vanusri?
Yeah, ma'am, sure, ma'am.
Yeah. Otherwise, you can include the literature studies with these objectives. That is also good. So when you do the next presentation with these findings, you include other literature findings about what is mentioned in our different textbook. That is also good to establish your study in further. Okay. Otherwise, you have compiled all the research findings and presented very nicely. Thank you very much, Vanusri. Other thing also I should mention, I think in your last presentation in other conference also I have mentioned, when you do the presentation about the literature review, literature study, or any reviews, you should mention the citations. That is very important. Okay, without the side, when you establish the full paper, definitely you should include the citations. But when you do the presentation also, you should mention these are the studies reported about the antimicrobial. These are the authors mentioned, like that. When you highlight the research and findings, you should cite their authors also. Okay.
Okay, ma'am.
Thank you very much.
Thank you so much, ma'am.
Thank you very much. From next, we have actually before the each presenter, there's a 15-minute presentation. So I hope you can be arranged within the 15-minute your presentation. So for next presenter, SKM Surangika from Gampha Vikramachi University. Surangika. Surangika.
Hello, am I audible?
Yes, you can start.
Actually, I am not the Surangika. I am a Dr. UPP Vijayatunga, one of the author of that particular presentation. Sir,
Okay. You can do it.
may I start?
Yes, you can start.
Yes. Yes. Thank you very much. Good afternoon, all of you. I am Dr. UPP Vijayatunga. Today, I am going to present my research paper regarding systemic review on dysmenorrhea, which is Kashtarthava in female infertility. That introduction says many women are experiencing dysmenorrhea as primary form of the disease, although it is a common symptom of various gynecological disorders. Hypersecretion of prostaglandins and increased uterine contractility are the causes for pain associated with dysmenorrhea. According to systemic review of studies from developing countries said, approximately 25 to 50% of adult women and 75 of the adolescents experience with dysmenorrhea. The prevalence of this estimated as 45 to 80% among the childbearing age female group. According to Ayurveda, it is mentioned as Kashtarthava. Infertility is defined by a failure to achieve a pregnancy after 1 year or more of regular unprotected sexual intercourse. It is possibility for women who are afflicted with dysmenorrhea. My research question is, what is the impact of dysmenorrhea, Kashtarthava, in female infertility among childbearing aged women? Let's move the background. Dysmenorrhea is one of the most common gynecological conditions causing several problems in the personal as well as the social life of a woman. As the cyclical pain associated with menstrual cycle is so as incapacitate day-to-day activities. The studies have shown that 90% of female population suffers from this condition, and among them, 10% are affected with severe forms of pain within the first 3 days monthly during their menstrual cycle. Primary dysmenorrhea says there is an abnormal contraction of the uterus due to the prostaglandin secretion in abnormal manner. Infertility has, and as well as the dysmenorrhea has the secondary dysmenorrhea, which has undergoing gynecological pathology regarding that female reproductive system as endometriosis, fibroid, PID. Infertility affects millions of people and has impact on their families and communities. WHO estimates that suggest that approximately 1 in 6 every 6 people of reproductive age group worldwide experience with infertility. My objectives are the study to explore the impact of dysmenorrhea on female infertility, and also the literature information from various texts that Acharyas has been mentioned their treatise to be followed. My methodology is data collection was done as systemic literature review by using Prisma method, which has published on Google Scholar, PubMed, and ResearchGate in 2022 in English. This Prisma diagram flow shows I have identified records for the search in 190 numbers of research articles. From there, researchers are duplicates. After removing those duplicates, I've remained 77 researchers. Then I exclude from there that our authors have not sent their full articles, and the not relevant articles I have been searched. There are a number of 11, so I excluded them. Then I included their full text articles assessed by for the eligibility number in 23. The record excluded with insufficient data, there was number in 9 research papers. Ultimately, I got to, for my systemic review, the number of 14 research articles. These are my findings and discussions. I made this systemic review for the qualitative summary as the qualitative summary report. The studies shows which I have taken for this summary report, they have optimum. They said that they have optimum quality of summarized data as follows. They mention dysmenorrhea is classified as primary and secondary. Primary dysmenorrhea, it is a painful condition without any pelvic and discomfort. Usually begins with at the age of adolescence. It is the crampy pelvic pain begin shortly before or at the onset of menses and last in 1 to 3 days. This diagram shows that excess or imbalanced prostaglandins, vasopressin, and chemical substance which is leads to the increased uterine contractility and cramping with the symptoms of nausea, vomiting, and diarrhea. Then secondary dysmenorrhea means there is undergoing pathology regarding the reproductive system. It also complains with the last longer than normal menstrual cramps. For example, the pain may begin a few days before a period of starts. The most common cause of secondary dysmenorrhea is endometriosis. One for arising the secondary dysmenorrhea, ovarian anomalies, tract anomalies, abnormal uterine bleeding, and vaginal discharge. According to Ayurveda, they have mentioned there are 4 factors which are responsible for the conception. We can say Ritu or the ovulatory period, Shestra, endometrium, Ambu, we can say those hormones, and Bija, which means ovum and sperm. Abnormality in any of these factors which are lead to one the other or the infertility. So Acharya said Vataja Udavarta Antarmukhi Suchimukhi Paripluta Vipluta Yoni Vyapad lead into Kashta Artava or the dysmenorrhea. They further said all these reasons are the causes for the female infertility. In Charaka Samhita 30 chapter says, if in a woman with the cause of natural urges are reversed and made to move upward, then the aggravated Vayu causes upward movement of the female genital tract. That makes the afflicted with the pain. She gets painful menstruation because of the tendency of the discharge to move in the reverse direction. Immediately after discharge of menstrual blood, she gets relief from the pain. Because of this tendency of the menstrual blood flow to move upward, it mentioned as Uda Urdava, the wise physician called this ailment as Udavartini. In Udavarta Yoni, the woman eliminates frothy menstrual blood within difficult pain. Other than these main symptoms, pain and other symptoms related to the aggravation of Vata will be expressed by Acharya Sushruta. According to Acharya Ashtanga Hridaya Samhita, Vata aggravated by suppression of the urges, torments the vagina and expels frothy menstrual blood with difficulty with the disease in Udavarta. Pain strictly restricted to menstruation and nearer to the spasmodic dysmenorrhea. So moving to the conclusion, when I go through that all the researches which I have been searched, all the studies showed that secondary dysmenorrhea, which has specific underlying gynecological pathology, makes impact for the female on their fertility directly. The pathological changes arise on female hormone changes for fertility. In 5,000 years ago, the Ayurveda medical system explored the same situation as Kashta Artava, which is present as the symptoms of Yoni Vyapad like Vatala, Udavarta, Vipluta, Vatiki, etc. Ayurveda text further said that all the Yoni Vyapadas leads to the manifest female infertility while making impact their lives. So some of my references I have been mentioned. Thank you.
Dr. Vijita?
And just Sampath.
Yes.
Actually, what's the name of the presenter? Is it Suranga? Surangi?
Vijayatunga, madam.
Vijayatunga, you have done a very good presentation. The thing is since it is a systematic review, you have taken so many papers and explored some papers and found the results and compiled the results and presented today. So it was the very good attempt. But my suggestion is to, when you do
Yes,
the
madam.
presentation, yes, when you do the presentation for the systematic review, it's better to mention the citations within a
Okay.
brackets.
Yes,
It's
madam.
one of my suggestion. Thank you very much. It was very
Thank
informative one to us, because since we are the Siddha people, the Ayurveda treatment and the definition, even the pathogenesis, are very enthusiastic to learn. So I had a very good time with you. Thank you very much.
Thank you very much, madam.
For our next presentation, Dr. WHSL Jayaratna. She is from Postgraduate Institute of Indigenous Medicine, Gampa Wickramaditya University.
Good afternoon, everyone. Am I audible?
You are audible. You continue.
Thank you, madam. Good afternoon, everyone. First of all, I would like to introduce myself. I'm YHPKL Karunatilaka from a Faculty of Indigenous Medicine, Gampa Wickramaditya University of Indigenous Medicine, Yakkala. Today, I will present the result of our research on the topic, the impact of maternal nutrition on fetal outcome. This presentation includes a brief introduction, our aims, methodology, results and discussion, conclusion, and finally the references that we have used. Let's talk about a brief introduction of our research. First of all, I would like to describe the word malnutrition. Malnutrition means deficiencies or excess in nutrition intake, imbalance of essential nutrients, or impaired nutrition utilization. So it includes both undernutrition and overnutrition. So maternal nutrition before the pregnancy and during the pregnancy significantly influences reproductive health. And also it is important for optimizing pregnancy outcomes. The provision of nutrition to the developing fetus relies on maternal nutritional status that include nutrition stores, dietary intake, and obligatory requirements. According to the Ayurveda, Garbha Utpatti, that means the genesis of life, centers around the pivotal factors like Ritu, Shestra, Ambu, and Bija. Ritu means ideal season in terms of fertile period of a woman. Shestra means fertile land in terms of disease-free healthy womb or a disease-free whole female reproductive system. Bija means healthy seeds in terms healthy sperms and healthy ovums. And the Ambu means proper water or nutritional supply that include fetal circulation. So this Ambu playing an important role in Garbha Poshana, that means fetal nourishment. This understanding forms the foundation for developing targeted nutritional interventions with the potential to enhance birth outcomes, ensure the long-term health of newborns, improve quality of life, and reduce mortality, morbidity, and healthcare costs. In this slide, we show the cycle of malnutrition. Most often, the cycle of malnutrition starts with pregnancy, when malnourished pregnant women are more likely to experience the condition like anemia, which can result in serious pregnancy complications. It includes maternal and child death. Infants born to malnourished mothers may be born too small or too soon. So both of which increase the risk of early deaths. Additionally, poor nutrition during the critical first 1,000 days that include the first day of that start from the first day of conception and to the age of 2 can cause irreversible damage to a child's growing brain. So that result impairments of the mental development and also increase the risk of chronic adult diseases in future. And also, the low birth weight baby will grow as a malnourished child or stunted child. And this stunted child also grow as a malnourished or stunted adolescent. Again, a stunted adolescent result a malnourished woman. So the preconceptional period, pregnancy stage of a woman, a lactation period of the woman, and also the reproductive age of the women are very important stages of women's life. So it's clear that women have special dietary needs during each stages of their life. This is our aim of the research. Our aim is to comprehensively explore the foundational factors of Garbha Utpatti, emphasizing the centrality of maternal nutrition in fetal development. This is the methodology of our research. We collected our data from Ayurvedic texts like Charaka Samhita, Shushrata Samhita, and also from the Ashtanga Hridaya Samhita, Madhavanidhana, Sharangadhara Samhita, Bhava Prakasha, Kashyapa Samhita, and Harita Samhita. Also, we collected data from electronic databases like PubMed, Scopus, Google Scholar, and we used the data from different 25 journal articles, and also we drain from 11 articles published between 2012 to 2022. Let's move on to the results and discussion of our research. Ayurvedic principles highlight Rasa Dhatu's threefold role in maternal growth, embryonic support, and contribution to breast development and milk formation. This Rasa Dhatu means the essence of nutrition. As we all know, the mother and the growing child is a single unit. Nourishment to the fetus is offered through Ahara Rasa, or the essence of nutrition of mother, through fetal circulation. This nutrition is essential for the fetus to develop and grow in the womb properly and proportionally. If this nutrition to the embryo is cut off, the fetus doesn't grow properly. According to the Ayurveda, incorrect Garbha Poshana leads to issues like congenital malformation, intrauterine growth restriction, and abortion. Modern parallels tie fetal nourishment problems to intrauterine growth restrictions, placental causes, and intrauterine fetal death from nutrition deficiencies. Maternal nutrition can stem from inadequate calorie intake, resulting in undernutrition or overnutrition. In developing countries, maternal undernutrition is a major factor contributing to adverse in pregnancy outcomes. Also in developed countries has a prevalence of high calorie diets and result in overweight and obesity issues, and the impact of the overnutrition situation upon pregnancy leads to cardiometabolic diseases, including obesity and hypertension in the offspring. Additionally, poor quality diets with reduced micronutrients contribute to this issue. Those micronutrients like zinc, folic acid, iron, calcium, vitamin D, and also omega-3 contribute to this issue. As an example, reduction of folic acid and vitamin B12 leads to neural tube defects in fetus, and also researchers reveal that the fish intake is good for the fetal neural development. Each condition significantly impacts pregnancy and infant outcomes, emphasizing the critical role of maternal nutrition. Addressing these factors is essential for promoting healthy pregnancies, preventing complications, and ensuring the overall well-being of a mother, both of a mother and a child. The discussion navigates Ayurvedic and modern medical perspectives on maternal nutrition, emphasizing the needs of awareness and intervention to address intrauterine growth restriction and associated complications. Also, maternal BMI and gestational weight gain are crucial in adapting to increased energy needs during pregnancy. Evidence supports their role as predictors of short-term and long-term maternal and fetal outcomes. Also, optimized pre-pregnancy BMI and providing counseling for adequate weight gain during pregnancy should be a priority for healthcare system and also the healthcare providers. These measures aim to reduce adverse outcomes related to pregnancy and infant health, highlighting the significance of proactive maternal care. Also, comprehensive reviews of randomized controlled trials and observational studies worldwide consistently reveal the benefits of adequate maternal nutrition before and during pregnancy for improved pregnancy outcomes. Emphasizing the need for nutrition education should target not only the pregnant mothers, but also the fathers, older women, and children to promote advocacy for optimal nutrition during pregnancy. Integrating nutrition education into various opportunities can contribute to preventive measures aiming to reduce adverse birth outcomes and enhance overall maternal and child health. Let's move on to the conclusions. The presentation concludes by highlighting the intersection and disparities between Ayurvedic principles and modern medical insights on maternal nutrition and fetal health. Emphasis is placed on the urgent need for awareness and interventions, particularly addressing IUGR or intrauterine growth restrictions with the focus on integrating Ayurvedic practices like Masanumasini Garbhani Paricharya into prenatal care. This Masanumasini Garbhani Paricharya is the healthy lifestyle protocol for pregnant women described in Ayurvedic texts like Charaka Samhita before 3000 years. Also, Charaka Samhita described that if a pregnant woman is taken care of as advised, she will give birth to a child who does not have any disease, but a healthy, physically strong, and well-nourished baby. Finally, the conclusion underscores the importance of prioritizing pre-pregnancy BMI optimization and counseling during pregnancy to achieve adequate gestational weight gain, aiming to mitigate adverse outcomes for both pregnancy and infant health. These are the references that I have used. Thank you so much.
Dr. Vijita?
Yes. Dr. Karna Tilaga?
Madam, I'm an undergraduate student.
Okay. Okay, undergraduate student. Okay, Karna Tilaga. You have done a good job during your undergraduate time. It's very important to learn about what are the nutritional factors which are influenced in the embryology life. So the presentation was very informative one. I have one suggestion to you in the methodology slide. Okay, can you take the methodology slide? The
Okay,
data
madam.
collection method.
Okay, madam, sure.
Data collection method. Okay, this slide. Okay. In the data collection method, you have mentioned primary data and the secondary data. There are some differences between the primary data and the secondary data. The primary data means it's what are the data that you have generated by your own. It's considered as a primary data. For example, when you are doing the randomized clinical trial, you are collected some data. through the questionnaires or interviews, small group discussion. Through these tools, you have collected some sort of data. Those data are considered as a primary data. Whatever data you have originated. Okay, the secondary data, that means it was already generated, and that means it was the existing data. So all these your data, that means the textbooks and the journal articles from the different databases are considered as a secondary data because it's a literature study. Am I right, Karnathalaga?
Okay, madam.
So with that suggestion, you should change this slide. All the data are considered as a secondary data. There is no original data you have because you are compiling the literature and do the presentation here. Okay. So
madam.
with that suggestion, otherwise it's very good presentation and informative one for us. Okay. Thank you very much.
Thank you, madam.
For our next presenter, Dr. P.D. Jayasumana. Dr. Deepani.
Good afternoon, everyone. Am I audible?
Yes. Yes, you can start.
Yeah. I'm KTS Ganegama from Faculty of Indigenous Medicine, Gampa Wickramaraju University of Indigenous Medicine. Today, I'm going to present my research on comprehensive literature study on approach of Ayurveda for female infertility. So these are the outcomes of my presentation. It includes introduction, aim, methodology, results, discussion, conclusion, and preferences. First, I'll introduce my research. Infertility is a significant public health issue in the modern world. It affects over 10% of women involved in active marital relationship. Actually, Ayurveda is a science which has both preventive as well as curative aspects. Reproduction is one of the primary requirements of any species to continue its existence in the universe. The factors mentioned in the Ayurveda, which are most possible factors responsible for infertility, includes yoni dosha, Manasika Abhitapa, Shukrartava dosha, Ahara Vihara dosha, and Balakshya. The fertile ratio of Sri Lanka, which was 5.0 in 1965, has decreased to 2.128 at present era. Actually, infertility is a major clinical impact as an embracing problem as well as burning sociological issue in universally. According to the WHO, infertility has become a global challenge in the modern era compared to past decades. Therefore, it's a major requirement to turn back to history and compile valuable cultural data before the information is destroyed over time. Fertility has been an essential for production of a healthy progeny, thereby making possible the transmission of genetic made from the parent to the next generation for a healthy human development, both socially and economically. So, aim of the research is determination of Ayurveda approach regarding female infertility. The research was done as a literature review. It was done as a conceptual study through Ayurvedic Samhitas and databases. Ayurvedic Samhitas including Budratraya, Lagutraya, Kashyapa Samhita, and Harapa Samhita. Databases includes PubMed, ScienceDirect, Google Scholar, Scopus, and ResearchGate using the keywords female infertility, essential factors of conception, and one method. So these are the results of my research. Fertility has an overwhelming importance given equity to Stree and Purusha in terms of Shukra and Shuddha Shonita for Garbhadharana. There are 4 factors responsible for this. They are Ritu, Shestra, Ambu, and Beecher. In the due course of time and due to various physical, psychological modifications influenced by food habits, lifestyle, environmental, and miscellaneous factors, result in a remarkable decrease in rate of infertility. Ayurveda has advised various forms of ahara, vihara, ritucharya, dinacharya, and aushadha for the swastha rakshana, vikara prashamana, considering the reproductive health of an individual. According to Acharya Charaka, all diseases occur due to imbalance of Agni and result in build-up of Ama. Ama formation results in Shrotoroda. It leads to Vata Prakopa, then it leads to Koshtagnimandya, and then it develops Dhatu-Nimandya, especially improper functioning of Rasa, Rakta, Meda, and Shukra Dhatus. So an approach is to manage and treat the condition and implement Rasayana and Vajikana therapies successively in preventive as well as curative, especially. So this is the discussion of my study. Actually, a healthy reproductive life concentrates upon the procreational, recreational, and relation aspects of life. Preconception care could be considered as one of preventive measures, and it helps in early identification of high-risk factors and prevents the adverse effects of that. Also improve maternal, paternal, and child health in both the short and long term. Preconception care can be defined as the provisional of biomedical, behavioral, and social health interventions to women and couples before conception. Ayurveda medical system rich with well-described preconception care in terms of Garbhadharan Vidhi since centuries back, and mainly emphasizes healthy and strong progeny by following regimens. And also, infertility can occur vitiated Ritu, Shestra, Ambu, or Bija. In such situation, Ayurveda can contribute tremendously with the effective preconception care, and it helps to fertility, minimize complications of pregnancy by changing the physical and mental status of couple within for pregnancy. So I concluded that infertility can be managed by looking at the reproductive system components. Ayurveda pays attention to each individual body types, enhances the body systems, participating in the process of fertilization, and therefore serves as an excellent alternative for reaching fertilization. So these are the references that I used. Thank you, everyone.
Dr. Vijita?
Yes, Sambat. Okay.
Yes.
The way she presented the slide was extremely good, but I would like to say some suggestion for all the researchers, not to the particular researcher, because this time I observed there are many presentations related with the infertility and the gynecological diseases, many presentations. So most of the researchers are in the literature review, mostly the literature studies. When you do the presentation in the literature research, you should mention about the literatures. That means the citation you should mention even in the presentation as well as the research paper. That is my suggestion for all the researchers, those who have done the literature study and going to be presented. The other thing, these are the literatures, literature information which you can found in the literatures, in the textbooks you have found. But the research is somewhat different, because what is your finding, that should be indicate in the research, in your presentation. What is your finding? Because when we open the textbooks, we can find these types of information. Now the social media platforms are there, many digital libraries are there, then we can find all these information through the Google even. So when you do the presentation, you should show what is your finding, that what is your original research. So as to the undergraduate students, for the future presentation, please focus on there are some active researchers and active research findings we are expecting from you. That's it. Thank you.
Thank you, Dr. Vijita. And our next presenter, Dr. J.A.N. Sadamali.
Am I audible to you?
Yes, you can start.
Good afternoon, everyone. I am TDHR Madhushani from Faculty of Indigenous Medicine, Gampha Wickramarachchi University of Indigenous Medicine. And my study is based on efficacy of Diyamittadi Kashaya in the management of uterine fibroids, which is also called as Mansarbuda. This is a literature review. Then I am coming to my contents. It includes the background of the research, aim and objectives, introduction, methodology, result and discussion, conclusion and suggestions. First, I am coming to the background of my research. So, first of all, we have to know what is the importance of doing this research. So, for that, I have included this. And the uterine fibroids are the most common reproductive tract tumor, which is occurred in the childbearing age of the woman, because that due to the physical inactivity, busy lifestyle, that food habits of the women, this uterine fibroids can be generated. And also due to this, that diminish that quality of life and disruption of usual activities, and also lost work time associated with symptoms, and also expend more on the healthcare providers, are causes are happen due to this. And also there are limited medical therapies are there. From that, mostly we are going through the invasive treatments such as surgical removal of the fibroids and the hysterectomies. So it's very much important to know internal medicines which can be used in the management of uterine fibroids. So that's why I have taken this into consideration. As I earlier said, this is type of a tumor, but that is not in a malignant nature. This is a benign tumor. So that is not a cancerous one, and also develop it in or the around the womb. So it's made up of that muscle and fibrous tissue. The size of the fibroid can be vary, and this is called as uterine myoma or leiomyoma. So this is very much originated at the woman's at the reproductive age, because that sex steroids are having the influence of to grow this. That's why this is having most of the women this having at their reproductive age. So those leiomyomas are a benign smooth muscle neoplasm. So that is the that can be the definition. Leiomyoma, it's a benign smooth muscle neoplasm that originate from the myometrium, and also due to the fibrous consistency of this is called as fibroids. Then I'm coming to my aim and objectives of this research. So this is from this study, I want to emphasize that ingredients of the Diyamittadi Kashaya, which can be successfully, which was used in successfully in the management of uterine fibroids. So I want to emphasize the medicinal qualities of this Diyamittadi Kashaya. So other than surgical interventions, we can use the internal medicine to cure those fibroids. So when I'm coming to the methodology, I have selected mostly used Kashaya in National Ayurveda Teaching Hospital Borella and Bandaranayaka Memorial Ayurveda Research Institute in Navinda. So from this, I have selected the Diyamittadi Kashaya, which is most effective and very much used in the treatment of the fibroids. So after selecting this Kashaya, I have selected randomly 60 research articles from the which are related to the Kashaya and the uterine fibroids. So I have excluded 15 research articles which have in that non-English articles, and also some are inappropriate because that Kashaya is that Diyamittadi Kashaya is not in there. So that's why I have excluded 15 articles, and I have included 45 articles from that. And I as primary data, I have taken authentic Ayurvedic text as well as indigenous text to find out the literature about these ingredients. Then I am coming to my results. So according to the literature, though this is called as Mansarbuddha, this comes in Ayurveda literature, this comes under Granthi. And pathogenesis, when we come into the pathogenesis, this having the predominancy of Vata and Kapha dosha, but the Tridosha involvement is there. But Vata and Kapha dosha are very much involved in this condition, though these have that Tridosha involvement. Then coming to the dosha, it means the affected tissues. So they are Rakta, Mans and Meda. It means that blood, muscles, and also the adipose tissues. Then coming to the Sroto Dushti, it having that Sangha Vimarga Gamana Ati Pravrutti. It means that blockage of channels can be happen, and also the pathway of the channels can be changed, and also the accumulation of more dosha in the respective site is happened on this condition. Then so I have discussed that Ayurvedic concept of these fibroids. Then I'm coming to the modern intervention. So here that these are the types of fibroids: intramural fibroids, subserosal fibroids, submucosal fibroids. So from these, most common type of fibroid is intramural fibroids, which is developed in the muscle wall of the uterus. And when coming to the subserosal one, it is developed outside wall of the uterus and can become very large at the pelvic cavity. Then coming to the submucosal one, it is developed inside the uterus, in the layer beneath the womb's inner lining, and growth into the cavity of the womb. So those subserosal, submucosal fibroids can be attached to the womb with a narrow stalk. So they are calling as pedunculated fibroids. Here you can see these types of fibroids. Then coming to the symptoms, heavy menstrual periods or painful periods can be seen, and lower abdominal pain, lower back pain, frequent urination, constipation, pain or discomfort during sex. Those are the common symptoms we can see in the uterine fibroids. So sometimes this mimic with the early pregnancy, because some are having the symptoms like in early pregnancy. So fibroids can be grow anywhere in the womb with the variation of size. It can be from a size of a pea to size of a melon. So it can become very large. Then I am coming to my kashaya. It means that Diyamittadi kashaya, which we have selected to the management of the uterine fibroids. So it includes 13 ingredients. Those are Haritaki, Terminalia chebula, Bibitaki, Terminalia bellerica, Amalaki, Emplica officinalis, Danyaka, Coriandrum sativa, Gugul, Commiphora whitei, Rusticali, Tragia involucrate, Pipali, Piper longa, Haridra, Curcuma longa, Daru Haridra, Cocinium fenestratum, Pata, Symphococcus pereira, Kalajaji, Nigella sativa, Patola, Trichosanthus cucumerina, Chopachini, Simlax glabra. Those are the ingredients of Diyamittadi kashaya. Then I am coming to properties of these kashaya. Collectively, when we are talking about the Diyamittadi kashaya, this having that lagu, it means that lightness, ruksha, giving dryness, tikshna, sharpness, and Vishada-like qualities, and Saraguna, Deepana, it means that increase the digestive fire, Anulomana, that agents removing dosha to the downward direction, Lekana, that having the scraping activity, it's very much important in the management of fibroids, and Medohara Kappa Daurgandhara activity, Hrdya activity, Rakta Prasadana activity, it means that having blood purifying agents. Then I am coming to my discussion and conclusion. As I earlier said, these according to the Ayurvedic authentic text, the fibroids can be related with the Granthi in Ayurveda. So, Granthi Chikitsa should be done with the management of these fibroids. So, to do that, we have to do the Samprapti Vigatana. It means that destruction of the pathogenesis of the uterine fibroids. For that, we have to use that in here, that it says Mansa, Ratta and Medo Dhatuha vitiated. So we have to get into normal of these dhatus. It means that tissues. For that, Diyamittadi kashaya can be used with its lagu, ruksha, tikshna, vishada, sara, deepana, lekana, medohara, and kapadauravgandhara qualities. With these above qualities, we can do that samprapti vigatana of this uterine fibroids. And also, especially tripala, it means the aralupulu nelli, and also trikattu, inguru gammiris tippili, those have which are mixed with the guggulu can break down and eliminate the hardened copper. So here that if you can remember the predominant doshas having predominant doshas of these fibroids having that kapha dosha. So if we can break down and eliminate hardened copper, it's very much important to use this kashaya to management of the fibroids. And also this support that proper function of the lymphatic drainage and the digestive system. So it preventing that further accumulation of copper. It's also very much important to management and the destroy the further development of these fibroids. So my conclusion is Diyamittadi kashaya can be very much successfully used in the management of uterine fibroids. So my suggestions are to do further researches, and also to do technological advanced researches for and do clinical trials, and also do phytochemical analysis for this kashaya. It's very much beneficial in the future management of these fibroids. Here are some of my references, and thank you all.
Dr. Vijita,
Yes.
you have any comment for her?
Just. You have done the very good presentation. It was informative one regarding the selection of the medicines and about the uterine fibroid in Ayurvedic, in the view of Ayurvedic system. But my suggestion is your title itself, you have mentioned it's a review article. Am I right?
Yes, madam.
It's a review article. So you have done this review article under some supervisors, no?
Yes, ma'am.
Yes, it's okay. The review means you should take the information from different sources. After that, you should compile all the information with your critical argument. That it's called as a review. The review article should be done by the subject expertise because they only know about the in-depth knowledge of the subject. So somehow you have done the review article under the supervision of the lecturers or the subject expertise. It's very good. But when you do the review article in future review article, does not means the copy and paste from the books and the articles. Okay, can you understand what I say?
Yes,
Okay,
madam.
you should do the critical argument in your writing style. That is known as the review article. So in future, you will include all these things and do the nice review article. Okay, I hope. Otherwise, it's good. Okay, thank you.
Thank you, madam.
For our next presenter, RMAK Ratnayaka, Kampa Vikramachi University. Ratnayaka presenter.
Sir, am I audible?
Yes, you can start.
Okay, sir. Good morning, all of you. I am Achan Ratnayaka. I am BMS undergraduate student from Gampaha Vikramarachi University of Indigenous Medicine. Today, my research topic is assessment of antifungal potency in Trigonella folium graecum and Melaleuca leucodendra extracts again Candida albicans 928 and in vitro investigation. Let's move to the background. Vaginal candidiasis is a vaginal mycosis infection caused by species of the genus Candida. It is estimated that 75% of women during the fertile period have at least one episode of vaginal candidiasis. Percentage of infections caused by Candida albicans was high in the past decades and varied from 85% to 90%. So decoctions of seed of Trigonella folium graecum and bark of Melaleuca leucodendra are used to vaginal washing in Ayurvedic treatments. Antifungal agents, especially triazole compounds, can cause Candida albicans and other related human pathogenic species to become resistant through various means, such as modification of antifungal target protein, modification of membrane external composition, and expression of efflux pump that decrease drug accumulation. Thus, there is an urgency to identify alternative therapeutic options. According to Sri Lankan Ayurveda pharmacopoeia, Trigonella folium graecum has Kapavata charmic action. Further, Sushruta Samhita recommends that coat or decoctions of Vadhara substances can be used to wash vagina in vaginal disorders. In Sushruta Samhita, simple is classified under Neogradi Gana and Lodradi Gana. Sri Lankan Ayurveda pharmacopoeia mentioned that.
Excuse me, Ratnayaka, the slides are not moving.
Thank you. Can you see the slides, madam? Excuse me. Madam?
Yes, tell me.
Move the slides.
Okay, madam. Now I am moving slide from the part I stopped. In Sri Lanka, Sri
No,
Lankan are the pharmacopoeia.
introduction slide. We can see the introduction slide only.
Okay, madam. Now I am telling the part of the introduction, madam.
Okay, right. Okay, then okay. You follow.
In Sri Lanka, Melaleuca leucodendra, in Sri Lankan Ayurveda Pharmacopoeia mentioned that Symplochus racemosa has astringent taste or kashaya rasa. And Sushruta Samhita recommend clean of vaginal passage by fine powders of these yoni purana for vaginal disorders. But in Sri Lanka, we use Melaleuca leucodendra as a substitute for Symplochus racemosa. So, the knowledge found in Ayurveda classics has to be validated by scientific. The aim of my research is assessing the antifungal effectiveness of extracts from Tribunella foinum dracum and Melaleuca leucodendra against Candida albicans 928 in an in vitro investigation. Let's do the methodology. I prepared decoction at Vaisajagara, Dravidian Department of Gampaha Vikramaraj University, and I evaluated the antifungal activity at Central Laboratory of Gampaha Vikramaraj University. I from the local market of Gampaha. I removed the impurities from collected plant materials. After tap washing, I allowed them to air dry for 3.5 hours at 40 centigrade. Let's go to decoction preparation. I weighed 30 grams of plant material and added them into 1,920 milliliters of distilled water. Then I heated them to reduce until 60 milliliters. After that, I filtered decoction through Waterman number 1 filter paper. Let's move to inoculum preparation. I took 3 or 5 colonies from standard Candida strain and suspended them in sterilite saline 0.9%. Then I adjusted the turbidity of my young culture comparable with McFarlane standard. The preparation of positive control. I prepared fluconazole solution into final concentration of 2.5 milligram per 1 milliliter. Let's move to method of media plate preparation. I prepared Mullery Hinton media according to manufacturer instructions. After autoclaving, prepared suspension of agar for 15 minutes under 15 IBS per 121 centigrade. I transferred them into sterilized petri dishes and left them to solidify. Antifungal activity assessment. I evaluated the antifungal activity by using agar well diffusion method. I inoculated 100 micromilliliter of inocula for agar plates, and I swept the inocula over the entire surface to gain a lone culture. After about 15 minutes, I created 4 wells with 6 millimeter diameter by using a cork borer. Then I pipetted 50 microliter of control as well as test samples into that label wells by a micropipette. There, fluconazole and distilled water served as positive and negative control. I replicated the same procedure for 3 plates. I incubated these 3 players for 24 hours at 37 centigrade. Now move to data analysis method. I measure the zone of inhibition for test sample as well as control sample, including the diameter of the cork border. I think the figure 6.1 shows how I measure the diameter across the zone of inhibition. I determine the activity index for test sample to compare the antifungal activity with the standard sample. Activity index equals inhibition zone of the sample divided by inhibition zone of the standard, like this formula. Let's move to my results. These are my results. I couldn't observe any zone of inhibition for decoction of Trigonella poenum and for the negative control. Now move to table 1. I told you I couldn't see any zone of inhibition for negative control and as well as Trigonella poenum decoction. The zone of inhibition for Melaleuca leucodendra in plate A was 10 milliliter and plate B was 9 milliliter and plate C was 10 milliliter. Then I calculated mean diameter for zone of inhibition for Melaleuca leucodendra. It is 9.67 milliliter. The diameter zone of inhibition for positive control in plate A was 26 milliliter, in plate B was 25 milliliter, in plate C was 25 milliliter, and calculated mean diameter for zone of inhibition for the positive control is 25.37. Let's move to activity index. Activity index for Trigonella poenum was 0 as there was no inhibition zone. But the activity index for decoction of Melaleuca leucodendra was 3.8116 10 to the power minus at 500 milligram per 1 milliliter. Let's move to my discussion. I didn't use high concentration. I utilized only lower concentration usually used to make yoni prakshalana in our Ayurvedic hospital, Gampaha Vikramaraj Teaching Hospital. Simple and water-based decoctions. And also, I didn't evaluate antifungal activity for other decoctions such as methanol, hexane, like that. Though I used Melaleuca leucodendra in my research as a substitute for Symplochus racemosa. Symplochus racemosa, which is mentioned in all of the text, would have produced an obvious inhibitory zone compared to Melaleuca leucodendra if I used as a test sample. In one word, this decoction may enhance antifungal activity by improving bioavailability factors such as ability of drug access the stratum corneum and by supporting other cellular mechanisms that impair the virulence. I think the effort is very important to develop a synthetic medication with natural remedies. So I concluded Melaleuca leucodendra decoction prepared following the standard Ayurvedic procedure for yoni prakshalana exhibits potential in controlling pathogenic Candida albicans, particularly the Candida albicans 928 strains. So thank you all of you.
Dr. Vijita?
Yes. Ratnanayaka, are you an undergraduate student?
Yes, madam. I am level 4 student, madam.
Level 4 students, I am happy to hear you here and see your presentation today.
Thank you very much.
Really, it's beyond the expectation of us. Here you have selected 2 decoction for the antifungal activities. Am I right?
Yes, madam.
Okay, so the results table for the inhibition zone for the trigonella decoction, the inhibition zone is 0 millimeter. Am I right?
Yes,
For the
madam.
trigonella.
Yes, madam.
So how you have concluded that the particular decoction has the fungal activities, even it was the inhibition zone.
No,
Zero.
madam. I conclude only Melaleuca leucodendra has antifungal activity.
Okay, when you compare the trigonella, this particular decoction has the antibacterial activity, antifungal activities.
Sorry,
Am I
madam.
right? When you compare the trigonella,
Yes.
your selected decoction has the or possess the antifungal activities. This is your conclusion.
According to my conclusion, according to my results obtained from this research, I
Okay.
conclude Trigonella corneum graecum don't exhibit antifungal activity in that concentration. In that concentration, sometimes it may.
If the concentration is increases, it may be shown antifungal activities.
Yes, madam, maybe. And also, I mentioned already in the discussion, in Volvo experiments, sometimes they may exhibit antifungal activity with the factors of
Okay,
bioavailability.
you are right. You mentioned the discussion part also, but what I want to say is when you when you present your results and finding, you should show some supportive literature documents. Then then you can defend your research very well. That is my suggestion. The discussion part, you should show some supportive documents, supportive literatures,
Yes,
which
madam.
are defend your studies.
Okay, madam. This is
Okay,
my
those
first.
things
Thank
you
you
in the
much for your
future research presentation, you include those things under the discussion part. Okay, thank you.
Okay. Thank you very much, madam.
Ms. Ratnayaka, just a moment. You have another question from Dr. Mati.
Hi, Ratnayaka. Nice presentation. So I agree with Dr. Vajita. So the thing is, you have taken 2 samples, right? But then again, as she said, you have to compare with that previous reported article, because otherwise we don't know whether your outcome is good or bad. So because otherwise we won't be able to come to conclusion also. So I strongly also advise that you have to compare your studies. Even you can talk about it in introduction, or maybe while you're talking about your results, you should able to speak, because with the results, but with the zone of inhibition, we are not too sure whether that is going to be an actual antifungal agent. And also, I have another question. So do you all do the toxicity studies also for your research? Hello?
No, madam, I didn't test the toxicity.
So do you all usually do the toxicity studies before you suggest?
No, madam.
So probably in future you all can think about it also doing some toxicity studies, because unless otherwise, we wouldn't be knowing it, because nowadays even loads of Ayurvedic medicine also, people do get lots of the problem in their, liver and kidneys and so on. That's my suggestion. Okay, thank you so much. Thank you.
Yes, madam. Thank you very much, madam.
I'd like to invite WMDS Pereira from Gampa, Vikramaditya University.
Am I audible to you?
You can start.
Hello. I'm Dr. W.M.D.S. Pereira from Faculty of Indigenous Medicine, Gampaha Marachi, University of Indigenous Medicine. Today I'm going to discuss about a survey on the assessment of the viability of Ratha Kalka in the prevention of pediatric dermatological ailments. In the background, pediatric skin problems are common globally, with eczema, infections, and pigmentary diseases being the most prevalent. Ratha Kalka, a traditional Sri Lankan polyherbal paste that is used to treat pediatric skin ailments. Before years, it is widely used in Sri Lanka as the first medication to newborns. It incorporates Dolichos biflos, which is called as Kollu, and Glycyrrhiza glabra, which is known as Valmi in Sinhala, Acros calamus, Vadakaha, Pterocarpus santalinus, which is known as Rathandun, Santalinus album, Suduhandun, and rock salt, which is known as Savindalunu in common terms, ground with lime juice and prescribed for pediatric dermatological ailments from the ancient times. But with the time, there is a drop of using this Ratha Kalka due to various problems. But today, even that have confirmed that Ratha Kalka possesses immune-enhancing, antibacterial, anti-inflammatory, non-toxic, and microbiologically safe properties. Not only the scientific studies, but also in the society, still there is a belief among communities that this herbal paste is effective in the management of skin diseases. Goal of my research is generally to investigate the effectiveness of Ratha Kalka in pediatric dermatological ailments in children between 1 to 7 years in Athanagala Divisional Secretariat. Specifically, my objectives are assessment of effectiveness in the prevention and also effectiveness in the management. Questions that I have come across with this research gives only data on 1 to 7 years old children living in a particular area, and also only Sinhala community is targeted, and depends on the literacy. This research depends on the literacy of the parents, and this is also directly depends on the accuracy of the information that they are providing. In the methodology, first I have set a research design, then data collection was done, then the data analysis was done. In the sample selection, I included the children between 1 to 7 years in Athanagala Divisional Secretariat and exclude the children who are below 1 year and above 7 years and who are not in the Athanagala Divisional Secretariat. In here, I have to emphasize that I have used this particular age group because the parents are not in memory about do they have given this Ratha Kalka to children or not when they are growing by the age. So I have selected particular children with age group 1 to 7 years. Then the initial awareness about this questionnaire and about this program was done to the parents, and questionnaire was shared among the parents. Initially, the data collection was done via the questionnaire. First, the flow of the questionnaire was like this. First question is your child is in between 1 to 7 years? If it is years, have you administered Ratha Kalka to them? If it is yes, do you have any kind of skin ailments? And also, the persons who are telling no to the administration of Ratha Kalka to their children, again ask about, do you have any kind of skin ailments? And depending upon the results, my analysis was done. And here, I selected the children who are having the skin ailments and who are not have taken Ratha Kalka from their childhood. and they were treated with 2.5 gram BD Ratakalka with coriander boiled water for 7 days and check whether the patches of the skin rash is fully present or disappeared. In the data analysis part, the collected data was analyzed using cross-tabulation method. In the results, I have selected 250 sample valid responses and 10 responses were invalid. That is due to incomplete questionnaires. And from that complete valid responses 240, 106 parents were given Hatha Kalka to their children and 134 has not given. From the group that have given the Ratha Kalka to their children, all the 106 are not having skin ailment up to now. And in case of the sample who are not given Ratha Kalka to their children, about 47 have suffering with skin ailment, and about 87 they are not having any symptoms of having a skin condition. Then I selected the 47 children that are suffering with skin ailments and they haven't taken the Ratha Kalka yet. Then we administer 2.5 grams of Ratha Kalka to them with coriander boiled water for 7 days and review the patients after 7 days. And from that, I found that 40 patients become fully recovered. That means 40 children got disappear the skin rash from their skins, and about 7, in case of about 7, there is remnants or patches of the skin rash present. In my discussion, I'm going to discuss that out of all the participants who responded, only 44.1%, that means 108, have given Ratha Kalka to their children, while 55.8% haven't, and it is nearly about 50%. And while any of the children who has had Ratha Kalka haven't suffered from any skin ailment, out of the 55.8, the prevalence of the skin disease was found to be 35%. And these parents were advised to administer Ratha Kalka, and about 40 had recovered from the skin conditions. Concluding my research, this is suggesting that Ratha Kalka had considerable potential effectiveness in preventing and treating skin issues in children aged between 1 to 7 years in Attanagala Divisional Secretariat. And more research is needed to establish its efficacy and to educate people more about its usage. These are some of my references. Thank you very much. And my sincere gratitude to the Ayurveda Community Medical Officers of Attanagala. Hello.
Yes, you have done very good presentation. The selection of the topic is very interested and mandatory for the pediatrics field. So I am very happy to see and hear your presentation today. Only my one question, because you have done this research by the assistance of the community medical officers, those who attach the peripheral hospitals. Am I right?
That is attached to the central dispensary, madam.
Central dispensary. So since you are the undergraduate students, you cannot prescribe the medicine. So you have prescribed
medical officer.
Under the medical officer. Okay, that should be mentioned in the presentation. The other thing, I felt the assessment criteria was not mentioned clearly. This is my feeling when you do the presentation. if you mention the assessment criteria very clearly, then your presentation would be complete presentation. Okay. So what is the assessment criteria you have followed for the main assessment criteria I am asking?
For the assessment, that a cross tabulation was done after collecting the results of the questionnaires.
So what are the signs and symptoms, and what are the things you have observed as a subjective criteria or objective criteria? Those things you should mention clearly, even under the methodology part and the results and discussion part. In the conclusion part also you should mention. That is the way you write the scientific writing style to write the survey reports. Okay.
Okay, madam. Thank you very much.
Okay. Right. Okay, Sambal, you proceed with the next presenter.
For our last presenter, AASAS Pereira.
Good day. I am Lanka. I am third year undergraduate from Faculty of Indigenous Medicine, Gampaha Wickramarachchi, University of Indigenous Medicine. My research topic is a systematic review of Dimbakoshagata Granthi polycystic ovarian syndrome. Polycystic ovarian syndrome is the most common disease in worldwide. It also leads to infertility, but many reproductive age women are not aware of this. In allopathic medicine, there is no cure for PCOS. According to the Ayurveda classic, if Dimbakoshagata Granthi is correlated with PCOS, this review will help to cure PCOS by introducing the right treatment and management plan for PCOS. Objectives divided in two parts, general objective and specific objectives. General objective in this research, systematic review of PCOD and Dimbakoshagata Granthi. Specific objectives are causes, etiopathogenesis, symptoms, and complication of Dimbakoshagata Granthi. Discussing that ovarian cyst can be cured according to Ayurveda by providing that ovarian cyst is similar to Dimbakoshagata Granthi. And I would like to give brief introduction about polycystic ovarian syndrome and Dimbakoshagata Granthi. Polycystic ovarian syndrome is a condition in which the ovaries produce an abnormal amount of androgens, male sex hormones, that are usually present in women in small amounts. The name of polycystic ovarian syndrome describes the numerous small cysts that form in the ovaries. However, some women with this disorder do not have cysts, while some women without the disorder do develop cysts. In some cases, a woman doesn't make enough of the hormones needed to ovulate. When ovulate doesn't happen, the ovaries can develop many cysts that can't cure PCOS in allopathic medicine. But Ayurveda has a very satisfactory line of treatment for ovarian cysts. According to Ayurveda classic, Vatsya and Kapacha Granthi will be correlated with PCOS. This review will help to cure PCOS by introducing the right treatment and management plan for PCOS. The research was conducted as a systematic review by preferred reporting items of systematic review and meta-analysis model. The data were gathered through primary data collection and secondary data collection. Primary data were collected in Ayurveda part, Charaka Samhita, Susruta Samhita, Ashtanga Harda Samhita, Madhava Nidana, Kashyapa Samhita. In the modern part, gynecology textbooks. Secondary data were collected, research articles, journals, internet sources. Now, I will move on to my result and findings. First of all, according to modern pathophysiology of PCOS, master pituitary gland releases excess of LH hormone. It causes increased production of male hormones from the ovaries. It causes failure of bursting of eggs follicle from ovaries. Then undischarged egg follicle becomes a cyst. Then this process gets repeated during every menstrual cycles. Multiple cysts get collected, resulting in PCOD. Now we will look at what are the common symptoms of PCOS. Irregular periods or no periods at all, we call oligomenorrhea, amenorrhea. Difficulty getting pregnant, excessive hair growth, we call hirsutism, usually on the face, chest, back or buttocks. Weight gain, thinning hair and hair loss from the head, oily skin or acne. According to Ayurveda Classic, there is no single disease entity in Ayurveda which could be exactly correlated to PCOS. Pushpakni Jataharani in Kashyapa Samhita shows a resemblance. Ruta Pushpa may be correlated to an ovulatory cycle and Lomasha Gandha to hirsutism. Amenorrhea is PCOS can be correlated with Nashtartava, Yadochita Kala Adarshana and Alpata as Arthavakshaya and increased bleeding as Ashukdare. Anovulation resulting in amenorrhea or irregular cycles is described under the Vandya Yoni Vyapat. Staula and Prameha Pura Rupa Lakshana are also seen in PCOS. Anarthava Nashtarthava Arthavakshaya Vandya Yoni Vyapat Pushpakni Jataharani Vranti Bhuta Arthava Dushti and Sandarpana Nidani can be compared with PCOS. Now this is the possible diseases which have to some extent compared to PCOS in Ayurveda. First one is Nashtarthava, as mentioned in Susruta Samhita, Avarana to function of Apanavata to expel the Arthava. Arthavakshaya, as mentioned in Susruta Samhita and Bhava Prakasha, Bhava Prakasha. In Arthavakshaya, there are features of oligomenorrhea, scanty menses, and painful menses explains PCOS only partially. Vikuta Jataharani, as mentioned, Kashyapa Samhita, menses are irregular. In terms of duration, menses may vary in duration of bleeding and color according to the interval and which menstrual bleeding is start. It seems to be due to oligo-ovulation or anovulation found in PCOS. Pushpakni Revati, as mentioned in Kashyapa Samhita, Ruta Pushpam Istura Loma Gandasha. Menses occurs regularly at the usual time, and the women suffering from this type of infertility have obvious cheeks covered with hair. It's also called hirsutism. And Granthi Bhuta Arthava Dushti, as mentioned in Susruta Samhita, seen in Bicharupi Arthava ovum is anovulation cystic ovaries. And Vandya Yoni Vyapat, as mentioned in Susruta Samhita, Arthava is destroyed. Vipala Arthava Dushti, as mentioned in Kashyapa Samhita, mentioned by Acharya Kashyapa, shows that either menstruation bleeding is not appeared or menstrual bleeding appeared, but ovulation does not occur. Granthi is the important things, as mentioned in Susruta Samhita, Charaka Samhita, Madhava Nidana. Granthi is considered a round swelling or enlargement in any part of the body. It has been taken in due to consideration basically because of the appearance of the cyst in the ovaries, which increases the volume of the ovary and gives it is a swollen appearance. Multiple cysts with the typical appearance of a string of pearls or pearl necklace These cysts are fluid-filled sacs in the ovary, which increases the volume of the ovary, giving its floral appearance. These are the hallmarks of PCOS. And also, Staulle, Arajashka, Pichadushti, Daive. Those in these diseases, characteristics are similar to PCOD characteristics. Now we will move on to discussion. Artha is the most important factor. It is two part, Antak Pushpa and Bahya Pushpa. Antak Pushpa means hormones and ovum. Bahya Pushpa means menstrual blood are both referred to as Artha in Ayurvedic literature. Study of etiology, pathophysiology, observing the signs, symptoms of PCOS and associated them with the features of Vata, Pitta and Kapha in their nature as well as in vitiated status. The potential doshaja vitiation seems to be Kapha Vata predominate the doshaja vikara. PCOS is a complex endocrine disorder associated with obesity, hirsutism, and recurrent anovulation. It is a leading cause for infertility and irregular periods. PCOD can be avoided and minimized by the practice of dinacharya and ritucharya as well as the patya ahara viharana, aushadha and apatya. This research conclusion is there is no single disease entity in Ayurveda that could be exactly correlated to PCOS. PCOS is found to be Vata Kapha disease along with radiation of Agni and Srotas. Involvement of Rasa, Rakta, Mansa, Meda, Asti and Artha Vavaha Srotas are seen with their Dushti Lakshana. Among Dhatus, Mansa and Meda shows more variation among PCOS. So these are my references. Thank you very much for your deep attention.
Thank you very much, Miss Mayomi. The way you established the results part and the discussion part is really appreciated. It's a way to establish the results and discussion for the literature or systematic review study. So I found you have done very well in your systematic review study. And also you have mentioned the polycystic ovarian syndrome more or less has similar symptoms in many diseases according to different textbook. So I have shown that slides also. In our Siddha medicine also, the polycystic ovarian syndrome can be correlated with the Sudahavayu or Karpavayu. These are the two things we can correlate with the polycystic ovarian syndrome. And I would like to see your objective slide. Can you share the objective slides?
Okay, ma'am.
Okay. Okay, when you formulate the objective, you should keep in your mind as an undergraduate students, this is for your future improvement in the research presentation and carry out the research work. When you formulate the specific objective, you should keep in your mind the objective should be measurable and achievable. So when you put the discussion in the objective, it will not nice. So the discussion is not a objective, it's a part of the research paper, part of the chapter in the research paper. That is the specific objective. You should correct the objective. Okay, in the first other specific objective also you have mentioned to find out, because nothing is mentioned here, to find out the causes, etiopathogenesis, symptoms and complication of particular the Ayurvedic term for the polycystic ovarian syndrome. So this is already present, available in your existing literature. Am I right? The causes are available, all these things are available in the existing literature. Am I right? So what you are going to find out, that is the research. What is your finding, what you are going to find out, that is the objective of the research. So you can correct this objective because you have shown the slides. There are different types of diseases, more or less similar to the polycystic ovarian syndrome according to different types of textbook. So you can change the specific objective as to determine the causes, etiopathogenesis, symptoms, and complication of the PCOS as per the different literatures. Likewise, you can change your specific objective. Okay. To do the literature studies in the future researchers, you mention those things when you write the article. Okay. Thank you very much.
Okay, madam. Thank you very much, madam.
Thank you very much for all the Zoom presenters and Dr. Vijita.
Yes.
We can wind up the Zoom session now, and we have only one physical presentation available, so we will do separately.
Okay.
And I want to thank you, Dr. Vijita Pahidharan, Senior Lecturer and Director, CEO, University College of Jaffna, Faculty of Siddha Medicine, Rincomalee Campus, Eastern University. Thank you very much for your support in the event and your comment for the researchers.
Thank you, Sampath, for the organizing committee also. I extend my sincere thank you for considering me as a keynote speaker and as well as the session chair. Thank you very much.
Before moving the lunch, we have only one presenter in morning.
Okay.
Fatima Hajara. So an invite. No.
A very good afternoon to all of you. My name is Hajira Muhid, and I am a graduate student from Northern India University. So the topic of my discussion here is the evaluation of the use of different solvents for the phytochemical profile and determination of antioxidant activity in leaves of selected brassica crops grown in Sri Lanka. Now, these are the contents that I'm hoping to discuss in detail in today's presentation. So this is something we are very familiar with, because at least once a week, our mothers used to make this. It's the Sri Lankan typical mallu. So not many of us are very fond of eating this. I, of course, don't like. So my mother used to tell me, eat this, so your hair will grow, your skin will grow. So many reasons she will point out for us to eat this. But they're not actually wrong, because plants are, the modern science and modern health sectors, they are insisting us on having diets which are rich in fruits and vegetables. So what is so special about plant is we all know that they have nutrients like minerals, vitamins, and fibers. But plant also has something called non-nutritious chemical, which is known as phytochemicals. So these phytochemicals have caught the eye of the researchers in the past few decades, because this could be utilized as a potential chemical for drug development. So why phytochemicals are so special is because phytochemicals are bioactive compounds. Bioactive compounds means that the substance can have an impact or trigger a response on a living tissue. Not only that, these phytochemicals or the bioactive compounds also acts as a antioxidant. They have the antioxidant property. So antioxidants, what they do is they neutralizes free radicals. Free radicals are the major cause of many diseases in our body, and it's naturally produced through our metabolic reactions. So if our body has an excessive load of free radicals and not enough antioxidants, there's a condition we'll develop called oxidative stress. Now, this antioxidative stress is the major cause for many diseases like this. So by including diets that are rich in phytochemicals, we can actually fight off oxidative stress and prevent so many diseases. So phytochemicals can be classified as such: carotenoids, phenolics, alkaloids, nitrogen-containing compounds, and organosulfur compounds. So in my research, I chose solvents, water and methanol as a solvent to extract the phytochemicals on the samples. So the general objective of my research is to evaluate the impact the water and methanol will have on the phytochemical content and the antioxidant activity with the species of brassica leaves, with the selected samples. The specific objective of my research is to determine the total phenolic content using Folin C method, total antioxidant capacity using ammonium molybdate method, to determine the total flavonoid content using aluminum chloride method, free radical scavenging activity using DBPH and ABTS method, and to determine antibacterial properties of the sample using E. coli and Staphylococcus aureus, E. coli and aureus using well diffusion method. So moving on to the methodology, this is a summarized version of the methodology. So first step includes the selection of sample, then you extract the sample, then you proceed with the analysis. So I analyzed my sample for antimicrobial activity, analyzed the sample for analyzed my sample qualitatively for phytochemical, then I analyzed quantitatively for antioxidant content and for free radical scavenging activity. So when it comes to sample selection, I chose brassica crops grown in Sri Lanka. Brassica crops includes broccoli, cauliflower, cabbage, nokol, and kale. These are very familiar vegetables in Sri Lanka. Almost all of us consume this on a daily basis. So, but I chose the leaves of these vegetables because even though we consume the floret or the bulbous bottom, we often throw away, discard the leaves. And many researchers have shows us that brassica vegetables belonging to brassica crops have a higher antioxidant content. So if the florets and leaves, if the florets and bulbous bottom contains a higher antioxidant activity and phytochemicals, then my curiosity will check out for the leaves as well and see if there's a higher amount of phytochemicals and antioxidants. So the sample were collected in 2022 October from Western Province. The sample leaves were carefully cut off and cleaned using distilled water and then proceeded for shade drying for 2 weeks. And maceration technique was used to extract the sample. We grounded the sample and then 2 grams of each sample were extracted separately with water and methanol, kept on a roller mixer, filtered using Whatman filter paper. The filtrate was obtained and further analysis was carried out. So first step, I analyzed the samples qualitatively to check the presence of phytochemical. I checked for phenols, saponins, tannins, quinones, flavonoids, steroids, alkaloids, and terpenoids with the above mentioned procedure. And then moving forward, I did my quantitative assays. First, I checked for total phenolic content using Folin C method. This is the mechanism of Folin C. this is the procedure I followed for to conduct the total phenolic content test. Total flavonoid content was determined using aluminum chloride method, and total antioxidant capacity was determined using phosphomolybdenum reaction mechanism. So this is a detailed explanation of how the procedure was done. And moving on to free radical scavenging activity, it was determined using DPPH free radical and ABTS free radicals. So DPPH free radical scavenging activity was determined using this method, and ABTS followed by. So moving on to my results, I'm sorry. Antibacterial susceptibility test was conducted using well diffusion, agar well diffusion method for water extracts and methanolic extracts on bacteria isolates of E. coli and S. aureus. So now let's move on to the results. So the qualitative analysis showed the presence of all the tested phytochemicals were present in all 5 samples in both water and methanolic extract, except for the saponins. Saponins were not present in the methanolic extracts of the sample. I have the graphs as well. The graphs. Okay. So I'm missing the graphs here. I don't know, some technical issue. Total phenolic content was calculated using Folin C method against gallic acid standard curve. The results of the total phenolic content, we'll explain it later. I've written down in the discussion part. I'm sorry, something is wrong with the. I'm sorry, something is wrong with the graphs. It's not showing here. So let me explain it in my discussion. So the results of the qualitative analysis, as I mentioned, only methanolic extract did not contain the saponins, These results also, the results I got also correspond with previous researches carried out by Kusmiati and Augustini 2023 and Chauhan et al. 2016. The reason for methanolic saponins are not present in methanolic extract could be due to the fact that maceration technique was used in this. So that could be a reason why we couldn't obtain or we couldn't see the presence of saponins. If it was done in a microwave assisted research shows that if we done it in a microwave assisted extraction, then saponins might be present in methanolic extracts too. So total phenolic content, water extracts showed a better phenolic content than of its corresponding methanolic extract. The value obtained in my study also consistent with previous studies reported the present in these vegetable extracts. Water extracts of kale, no-col, cauliflower, and cabbage showed a significantly higher total phenolic content than of its corresponding methanolic extracts. The overall statistical values suggest that there is a significant difference between the water extract, the value obtained for total phenolic content than the corresponding methanolic extracts. There is a significant difference. The total phenolic content, however, did not have a significant difference between the water extract and the methanolic extracts. However, broccoli water extract contained the highest amount of total flavonoids among all samples. If I move on to the antioxidant capacity, again, water extract showed a better antioxidant capacity than of its corresponding methanolic extracts. These results also correspond with studies conducted by Gari and al. 2015, Dragu et al. 2011. However, methanol extracts of the broccoli depicted a lower total antioxidant lower antioxidant capacity than previous study conducted by Gupta and Prakash. Statistical analysis shows that total antioxidant capacity of water extract was significantly higher than the methanolic extracts. If we move on to the free radical scavenging activity, again, water extract showed a better radical scavenging activity than of their corresponding methanolic extract. The reason for an increased scavenging activity in water extracts than of the methanolic extract could be due to the behavior of DAP pH is significantly affected by both solvent use and the pH of the reaction. So when the DPPH reacts with antioxidant, it undergoes reduction, and this reduction process tends to occur at slow rate in solvents that are capable of strong hydrogen bonding, such as methanol. Moving on to ABTS radical scavenging activity was high in water extract than methanol. No-coal and cabbage methanolic extract showed the highest and the lowest respectively. And then moving on to the antibacterial activity of the samples. Water extract of the sample indicated a better antibacterial activity than the methanolic extracts. However, at the concentration of 20 milligram per ml, E. coli growth inhibition was not observed in cabbage water extract, and the inhibition of S. aureus was not observed in broccoli methanolic extract and cabbage methanolic extract. The results are similar with studies conducted by Karwa et al. 2018, Dunja et al. 2013, and Hu et al. 2004. To conclude my presentation, water extract have showed a higher yield of TPC, TFC and TAC, and radical scavenging activity against DPPH and ABTS radical. Among the tested sample, water extract of broccoli and no-coal depicted a significant higher number of phenolic, flavonoid, and antioxidant content and radical scavenging activity against ABTS compared to other samples. Water extracts also showed a better antibacterial activity against E. coli and S. aureus. Therefore, it is evident the solvent used for the phytochemical extraction significantly impacts the phytochemical profile and antioxidant activity, and water is more suitable as a solvent compared to methanol, according to my research. So these are the references I used for the research. And coming back to the malum, so next time when your mother gives it, please have it. Thank you. Results.
So you have mentioned that the water extract has no pH frequency.
Yeah.
It would have been better with water and methanol, with them are polar solvents. So if you had non-polar solvents also, you could have seen what is actually happening.
Yes.
So if the polarity is influencing because methanol was a polar. So
Yeah.
I'm wondering why methanol is not giving, because most of these Ayurvedic companies are using methanol instead of water. So I'm not sure why your results shows that water extract has higher pH value than methanol. So that's because I couldn't see the graph. And also you have mentioned that in the DPPH, we can go to the discussion about DPPH, right?
Yes, ma'am.
The reason that you have given there is not valid, right? As you said, the water extract is maybe both solvent is not defective, because you have already mentioned that water extract has a higher antioxidant. So if you have more higher antioxidant, the DPPH would scavenge.
Yeah.
Right? So then you would have a better DPPH in the water extract than that could be the
Okay.
right? Okay. So but then if you have usually you can try to do with the
Thank you, Rachana. So now we are finishing in our morning session because the lunch they will close in 2:30. So you have to move early to there. So before go that, I need to give the all certificate. I need to invite Dr. Mati Kandaya to share this certificate to the today presenters. WIS Fernando and all the authors certificate also there. Atrupana. Fatima Hajara. Halim FH. KAB, Dr. KAB Pranadu. Aludgam. MACD Aludgam. And thank you. Thank you very much, Dr. Mati Kandaya. She is Dean, the BMS school in Colombo, School of Science. Thank you very much for spending your time and you are sharing your knowledge to the participants. And I invite you all to go to the lunch for the main restaurant, Tilanga, as soon as possible. Then otherwise they are closing 2:30.